So patients that use compounders are often well and truly focused on their own health. They generally go to an integrative doctor, which is a GP or a specialist doctor that's had extensive training in environmental sciences, and ultimately those patients are looking at future-proofing their well-being. So things like nutritional supplements that we make, bioidentical therapies, topical or oral, we also make, and these are generally the sort of patients that have been working with compounding pharmacies for many years. The market is certainly growing, so the compounding niche is now expanding to resolve drug unavailabilities, which then means that our customers become community pharmacies ultimately, because the medicines that they would normally supply their patients, once they become unavailable, will mean that ultimately they still need to supply their patient, and compounders can fit that mould perfectly. Without knowing exactly all of the intricacies of a mass manufactured drug, there's a fair chance that there's a product in that a patient, be it a child or adult, might have an intolerance to. The beauty of a compounding product is that we can use very simple ingredients and APIs, which is the active component of the product, and take all those flavouring agents, fillers, types of capsules away from the equation to hopefully reduce the chance of poor tolerability from the patient, or allergic reactions, or just general uncomfortableness when taking it. Especially kids with poor flavours in mass manufactured suspensions can use a compounded suspension which will give the same efficacy, but it will ultimately taste a lot nicer, which means parents' lives are improved and the compliance is even better from the patient. Great question. So the beauty of compounding is that everything can be combined into one dosage form or one capsule, and that can be a number of ingredients. It could be a patient's diabetes, it could be a patient's blood pressure, and the sky's really the limit. And once the product is combined into one single dosage form, they could ultimately stop taking 5 or 6 capsules a day and take one, which would still give them the same dose of all their active medicines. So great opportunity for the elderly patients.